The VITAL study was initiated a little over 5 years ago, and it took treatment-naive patients with any degree of light chain immunoglobulin amyloidosis and randomized them 1-to-1 between the monoclonal antibody, previously known as NeoD1, now known as Birtamimab, with standard of care chemotherapy, and compared those patients with patients who received a placebo every month, IV, and standard of care chemotherapy, with the goal to look at all-cause mortality as a primary endpoint. The original trial, which included all patients with light chain amyloidosis, was actually terminated after a futility analysis demonstrated that we'd never be able to prove the primary endpoint. But in a post hoc analysis of patients with Mayo Clinic stage 4 cardiac amyloidosis, it was demonstrated that in that subset analysis, there was a statistically significant improvement in all-cause mortality at 9 months, where 74% versus 49% of patients were alive at 9 months. And in addition to a mortality superiority, these patients showed statistically significantly improved quality of life and performance on a 6-minute walk test, which is a common endpoint in cardiac failure studies, that favored the use of Birtamimab, which in vitro causes the dissolution of existing amyloid deposits. So it really is targeting the amyloid that's already deposited in tissue, not just the production of amyloid by the clonal plasma cells. Well, you have to validate those findings in a prospective randomized trial. So this has led to the AFFIRM trial, where patients who are treatment naive with Mayo Clinic cardiac stage 4 are randomized to Birtamimab plus standard of care chemotherapy in a 2-to-1 randomization compared to placebo standard of care chemotherapy. And that would be, I think, a registration trial that would prove the value of Birtamimab. And again, the endpoints are all-cause mortality, 6-minute walk test outcomes, and quality of life outcomes. There's some secondary endpoints, including echocardiography and biomarkers and the like.